Let us now take a look at how the pharmacist can record the status of a drug order. The pharmacist can record a drug order being dispatched, put a drug order on hold, or request for a drug order to be discontinued. To begin with, let us log in as the pharmacy user. Enter the username and the password required to be logged in as the pharmacist. Now, click the button Login. Now, we have got redirected to the OpenMRS home page that is available to the pharmacy user. As we can see, the pharmacist has only got the privilege to access the pharmacy icon in order to perform the actions. Let us now click on the pharmacy icon. Now, we have got redirected to the pharmacy home page. This page displays a search field where the pharmacist can enter the name of the patient and find the patient records. It also displays a table that lists all the orders that are currently placed on hold or requested to be discarded. To begin with, let us find a patient record. The pharmacist has to click on this field and start typing the name of the patient. This gives a list of autocomplete options for the patient name. When the pharmacist clicks the name of a patient, the page preloads to give us the patient specific information. The pharmacist can use this information to determine the correct patient record. Now, clicking on this row will redirect us to the patient's drug order page, from where the pharmacist can view the list of current drug orders and take the appropriate action on recording them. Let us click this row. As we can see, we have now got redirected to the patient's drug order page. Here, the pharmacist can view the patient specific information, can view the drugs that the patient is allergic to, and the pharmacist can also view the list of active or current drug orders. This table displays the name of the drug, the start date, the number of refills allowed, the last dispatch date, and the orderer information. As we can see, this is a group drug order. That means it's meant to be dispatched together. Let us now click on this record. As we can see, the fragment on the right displays the list of selected orders comprising of codeine and aspirin. Here, the pharmacist can view information about the dose and the quantity. Additional details with regard to route, duration, frequency, diagnosis, allergy information, refills, interval, last refill date, and instructions from the physician for the patient as well as for the pharmacist can be viewed by clicking the Show Details icon. Clicking the Hide Details icon will close the details once again. Once the pharmacist ensures that the checkbox corresponding to each of these orders is checked, he clicks the Dispatch button. Now, this page loads a couple of other fields for the pharmacist to specify with regard to each drug order. The pharmacist needs to specify the drug's expiry date, as well as a note for the patient. This process needs to be repeated for each drug associated with the order group, or in case of single orders, with the order that is being dispatched. Once the expiry date and the pharmacy note is specified, the pharmacist clicks on the confirm button. Now, the order status is recorded as dispatched. As we can see, the table has reloaded to give us the updated refill information. The number of allowed refills is decremented by 1, and also the last dispatch date is recorded.